Have you ever woken up to find hair on your pillow? It's a sight that can catch you off guard, especially when you weren't expecting it. Maybe you notice a few strands scattered across the pillowcase, or perhaps it's a little more than usual. For many, this moment can trigger a wave of concern. After all, our hair is something we often take for granted until we see it somewhere it shouldn't be. Or maybe you've spotted extra strands collecting in the shower drain, or clinging to your hands after washing your hair. These little discoveries can add up, making you wonder if something's wrong. It's a moment that can spark instant worry. You might find yourself anxiously checking your scalp or counting the hairs you lose each day, searching for reassurance. You might wonder, is this normal? Am I losing my hair? Is there something wrong with my health? Or is this just a part of everyday life? These questions are common, and you're definitely not alone in asking them. Our hair is closely tied to our identity, so seeing more of it fall out can be unsettling. It's natural to feel a sense of panic or even embarrassment, especially if you're not sure what's causing the change. But before you panic, it's important to know that not all hair on your pillow means trouble. In fact, some shedding is a completely normal part of the hair growth cycle. Every day, your scalp naturally lets go of old hairs to make room for new, healthy ones. There's a big difference between normal daily shedding and true hair loss. Most people lose between 50 and 100 hairs a day, and this is usually nothing to worry about. It's when you start noticing large clumps, thinning patches, or a sudden increase in shedding that it might be time to pay closer attention. Shedding is a healthy, natural process. Your body lets go of old hairs to make way for new ones. This cycle keeps your hair looking fresh and vibrant. In fact, seeing a few hairs on your pillow or in your brush is a sign that your hair is renewing itself, just as it should. The key is learning to tell the difference between normal shedding and excessive loss. Pay attention to patterns over time. Are you losing more hair than usual, or is it about the same each day? Are you noticing changes in your hair's thickness or texture? In this guide, we'll break down what's normal, what's not, and what you can do about it. We'll help you understand the signs to watch for and when it might be time to seek advice from a professional. We'll explore causes, visible signs, and practical steps to support your hair's health. From lifestyle changes to medical conditions, we'll cover the factors that can influence hair shedding and loss. The goal: replace worry with clarity, so you can feel confident and in control of your hair health. With the right knowledge, you can take positive steps to care for your hair and scalp. Let's start by understanding what normal shedding looks like and when it's time to take action. By learning what's typical for your hair, you'll be better equipped to spot any changes early and respond with confidence. Your journey to healthier, stronger hair starts here. Let's dive in and discover how you can keep your hair looking its best every single day. Every hair on your head follows a fascinating and intricate cycle: growth, anagen, transition, catagen, and rest, telogen. This cycle is happening all the time, quietly and efficiently, whether you notice it or not. At any given moment, the vast majority of your hair is in the growth phase, working hard to keep your hair looking full and healthy, while a smaller percentage is preparing to shed and make way for new strands. Shedding happens when old hairs in the telogen phase naturally fall out, making room for fresh new growth. This is a completely normal and essential part of your hair's life cycle. Without this process, your scalp would become overcrowded, and new healthy hairs wouldn't have the space they need to thrive. It's normal to shed 50 to 100 hairs a day, hardly noticeable compared to the 100,000 hairs on your scalp. In fact, most people don't even realize it's happening, since the amount is so small relative to your total hair count. This daily shedding is a sign that your hair cycle is functioning as it should. You'll see more hair on wash days if you don't shampoo daily, as shed hairs collect and come out at once. This can look alarming, but it's simply the result of several days' worth of normal shedding being released all at once. It doesn't mean you're losing more hair than usual. Think of it like a garden. Old flowers fall so new ones can bloom. Just as a garden needs to shed its old petals to make room for vibrant new blossoms, your scalp needs to let go of old hairs so new, healthy ones can take their place. This natural renewal keeps your hair looking its best. Most shed hairs have a tiny white bulb at the root, a sign of normal shedding, not a problem. This little bulb is simply the base of the hair that has completed its cycle. It's a reassuring sign that your hair is following its natural rhythm. Shedding rates can change with the seasons, often increasing in late summer or autumn. This is a common experience for many people, and is thought to be influenced by changes in daylight, temperature, and even hormonal shifts. So if you notice a bit more hair fall during certain times of the year, it's usually nothing to be concerned about. As long as your hair's overall density stays the same, these fluctuations are nothing to worry about. Occasional increases in shedding are part of the natural ebb and flow of your hair's life cycle. If your hair still feels thick and healthy, your scalp is doing its job perfectly. Shedding is your scalp's way of staying healthy and vibrant. By letting go of old hairs, your scalp ensures that new, strong strands can grow in their place, keeping your hair looking lively and full of life. Understanding this process can help you stop worrying about every strand you see. When you know what's normal, you can focus on keeping your hair and scalp healthy, rather than stressing over natural shedding. Next, let's look at what causes shedding to increase, and how you can tell when it's time to pay closer attention to your hair's health. Sometimes, you'll notice more hair falling out than usual, hundreds of strands a day. This is often telogen effluvium, triggered by stress, illness, surgery, or major life changes. The body diverts energy from hair growth to healing, causing more hairs to enter the resting phase and shed a few months later. Diet changes, especially crash diets or low protein, can also cause increased shedding. Hormonal shifts, like after childbirth or stopping birth control, are common triggers. The good news: telogen effluvium is almost always temporary. Once the trigger passes, your hair cycle returns to normal. Focus on restoring balance, nutrients, rest, and stress management to help your hair recover. If shedding persists, it's time to look deeper. Hair loss is different from shedding. It means your hair isn't growing back as it should. Causes include damaged follicles, genetics, or medical conditions that interrupt the growth cycle. Unlike shedding, hair loss leads to visible thinning, bald patches, or a receding hairline. In pattern baldness, follicles shrink and produce finer hairs until they stop altogether. Autoimmune conditions like alopecia areata can cause sudden, patchy loss. Shedding is usually diffuse, while hair loss often follows a pattern or affects specific areas. Treatment for shedding focuses on removing triggers. Hair loss requires targeting the underlying cause. Recognizing the difference is crucial for getting the right help. If you see persistent thinning or bald spots, seek a professional diagnosis. Early action can make a big difference. Hair loss can be distressing, and for many, it's more than just a cosmetic concern. True hair loss often has deeper, ongoing causes that go beyond everyday shedding. Understanding what's happening beneath the surface is the first step toward finding the right solution. The most common culprit is androgenetic alopecia, also known as pattern hair loss. This condition is driven by a combination of genetics and hormones, particularly dihydrotestosterone or DHT. Both men and women can experience this, though the patterns may differ. DHT causes hair follicles to shrink over time, making each new strand finer and shorter. Eventually, the follicles may stop producing hair altogether, leading to gradual thinning and, in some cases, complete baldness in certain areas. But not all hair loss is genetic. Autoimmune disorders, like alopecia areata, make the immune system mistakenly attack healthy hair follicles. This can result in sudden patchy hair loss that may come and go unpredictably. Hormonal imbalances are another major factor. Conditions such as thyroid disorders and polycystic ovary syndrome, or PCOS, can disrupt the body's delicate hormone balance, triggering diffuse thinning across the scalp. These changes can be subtle or dramatic, and often require medical evaluation. Medical treatments, especially chemotherapy for cancer, can also cause rapid and widespread hair loss. The good news is that in most cases, hair regrows after treatment ends, though the texture or color may change temporarily. Some types of hair loss, like scarring alopecias, are more serious. These conditions destroy hair follicles permanently, replacing them with scar tissue. Once this happens, regrowth is no longer possible in those areas. That's why early diagnosis is vital. The sooner you identify the underlying cause, the better your chances of preventing further loss and preserving the hair you have. If you notice unusual patterns, excessive shedding, or persistent thinning, don't wait. Schedule a visit with a hair loss specialist or dermatologist. Early intervention can make a significant difference. Understanding the specific cause of your hair loss is the first step to finding an effective treatment plan tailored to your needs. With the right approach, whether it's medication, lifestyle changes, or medical procedures, many types of hair loss can be managed, slowed, or even reversed. Next, let's explore how to recognize the early signs of hair loss so you can take action as soon as possible. Hair loss shows up in distinct ways. For women, it's often a widening part or thinning at the crown, while the hairline stays intact. Men usually see a receding hairline or a bald spot at the crown, sometimes merging over time. Pattern baldness is gradual. but autoimmune loss like alopecia areata causes sudden, round bald patches. Diffuse thinning from thyroid or nutritional issues makes the whole scalp look less dense. Watch for changes in hair texture. New growth that's finer or more brittle can signal follicle miniaturization. Take note of any new bald spots, widening parts, or overall thinning. These visual clues help pinpoint the type and cause of hair loss. Document changes with photos to track your progress. If you notice these signs, it's time to act. Noticing more shedding or thinning? Don't panic. Stress can make things worse. Track your hair changes with a journal and photos for a few weeks. Consider recent stress, illness, diet changes, or new medications as possible triggers. If you spot a widening part, receding hairline, or bald patches, consult a dermatologist or trichologist. Specialists can diagnose the cause and recommend tests if needed. Accurate diagnosis leads to the best treatment plan. Avoid self-diagnosing. Professional guidance saves time and worry. Early intervention is key to better outcomes. Diet and lifestyle play a huge role in hair health. Hair is made of protein. Make sure you get enough from sources like eggs, fish, beans, or tofu. Iron, zinc, and biotin are essential. Low iron is a common cause of shedding, especially in women. Pair iron-rich foods with vitamin C for better absorption. Manage stress with mindfulness, exercise, or hobbies. Stress can trigger shedding. Prioritize sleep, your body and hair repair overnight. Be gentle. Avoid tight hairstyles, harsh chemicals, and excessive heat styling. Use a wide-tooth comb and choose products that support scalp health. Small changes in your routine can make a big difference. Healthy habits support both hair growth and overall well-being. Hair loss is common. Millions experience it, and you're not alone. There's more support and effective treatment than ever before. Seek answers and take control. Seeing a specialist is empowering. Don't be discouraged by myths or miracle cures online. Trust medical advice. Progress takes time, so be patient and kind to yourself. Celebrate small wins, like reduced shedding or new growth. Find support through friends, family, or groups. Your hair is part of you, but it doesn't define you. With knowledge and support, you can face hair loss with confidence and hope.